summarizes the publication Growth and Gastrointestinal Tolerance in Healthy Term Infants Fed Milk-Based Infant Formula Supplemented with 5 Human Milk Oligosaccharides, a randomized, multicenter trial. Human milk is the gold standard nutrition source for infants' growth and development, and provides important prebiotic human milk oligosaccharides, or HMOs. Improving the HMO profile of infant formulas to be more like that of human milk can be explored in a continued effort to bridge the gap between human milk-fed and formula-fed infants. Studies have shown that supplementing infant formulas with a single HMO, such as 2FL, or a combination of 2 HMOs, such as 2FL and lactoentetraose, was safe, well-tolerated, and supported age-appropriate growth. Formulas with these HMOs also provided immune benefits similar to human milk, including fewer reported respiratory infections and bronchitis. This study evaluated a novel milk-based infant formula supplemented with 5 of the most abundant HMOs in human milk, which are 2-fucosylactose, 3-fucosylactose, lactoentetraose, 3-sialolactose, and 6-sialolactose. The goal of the study was to assess the supplemental impact of these 5 HMOs on growth, gastrointestinal tolerance, and health outcomes in formula-fed infants. The study was a randomized, double-blind, controlled parallel feeding trial conducted at 34 study sites throughout the United States. The study evaluated growth in 129 healthy term infants fed a control milk-based formula compared to 130 healthy term infants fed an experimental milk-based formula containing a novel blend of 5 HMOs, 5.75 grams per liter of 2-fucosylactose, 3-fucosylactose, lactoentetraose, 3-sialolactose, and 6-sialolactose. A reference group of 104 healthy term infants was fed human milk in parallel. The study's primary outcome was weight gain per day from 14 to 119 days of age as a marker of growth. There were no significant differences observed between the 3 groups. Growth was similar among the 3 groups and generally tracked around the 50th percentile on the World Health Organization growth curve charts. Growth was also similar irrespective of pre-COVID and COVID study periods. No significant differences were noted between control formula, experimental formula, and human milk groups in most anthropometric measures of growth: weight, length, head circumference, and their interval gains. For the majority of results, experimental formula had softer stools, more stool frequency, more yellow stools, and lower constipation dimension than control formula, and were closer to those for human milk compared to control formula. A significantly higher proportion of infants fed control formula were seen by healthcare professionals for illness than infants fed experimental formula from entry to day 56 and day 84, but were not different from infants fed human milk. In summary, the results from this study demonstrated that the experimental formula with supplemental 5 HMO blend supported normal growth, GI tolerance, and safe use in healthy term infants.